Hello, my name is Alan Hibberd. I'm one of the orthopedic surgeons with the San Antonio Orthopedic Group. One of the questions that I'm frequently asked is, how do I know that I'm ready for a hip replacement? That's a very good question, and basically the first part is a diagnosis, because a lot of people will come to the office and they say, well, I'm here because I need a hip replacement. Well, the truth of the matter is, not everything that hurts about the hip is caused by hip pain. It can very often, even your knee will radiate pain to your hip. And the other is sometimes you can have pain in your back, a disc rupture or some sort of thing like that will radiate pain into your hip. So it's very important to come up with an accurate diagnosis. The other thing is, even though you may have some arthritic changes in your hip, a careful examination may show that in fact you have a tendinitis, which can be dealt very easily with just an injection. So the first part is just to arrive at a diagnosis, and then the second part is, once you do have arthritis, what would be the approach then? Well, for any type of arthritis, we start off with simple things, medications, injections, therapy sometimes will be a benefit. Failing those things, then you're probably looking at a hip replacement. Now, hip replacements, the problems from hip replacements or from arthritic problems with the hip are really twofold. One is pain. A lot of people will have normal motion of their hip joint, but they have terrible pain. So the pain is one element. The other thing is, very often a person will present not so much with pain, but with pretty severe limitation of motion of their hip. And when that happens, when you have very little motion of your hip, you can't reach around to tie your shoe, you have trouble reaching to the floor, and it changes your gait pattern. So your hip may not be bothering you that much, but it could be causing a lot of stress in your spine or in your knee. So those would be reasons to do it also. So once we decide that you'd be a candidate for it, and sometimes if there's some confusion where exactly the pain is coming from your hip, or your back, for your knee, we'll block your hip joint. We'll put some put some numbing medicine in your hip joint, and if that relieves your pain, then we know that's exactly where the pain is coming from. Then we probably proceed if every other thing has failed with a hip replacement. Now, the hip replacements that we have today will almost always relieve your pain, and certainly will give you a lot more motion. So we'll really deal with the two issues that we deal with in patients with degenerative disease of the hip. Now, the current implants are, we're always improving them. When I started out in orthopedics, we used to tell people maybe it would be good for about 10 years. But now we're probably up to 15 or 20 year survivability with the hip replacement. So that's definitely an improvement. So especially if you're elderly, and honestly, we do these operations all the way into people with their 90s if they're really vital and it's really altered their life. We'd like to improve the quality of their life, not just necessarily improve the hip function. But a lot of times they're very, very closely related. So just briefly about hip replacement, the surgery time is about an hour and 10 or 15 minutes. We have some new techniques now that we're using that so you don't need blood anymore, which used to be an issue for some people. Working with our anesthesiologist, we have special ways that we are able to block the nerves and diminish the pain around your hip surgery. So most patients these days, they have very little pain for the first couple of days. We take advantage of that. With the therapists are working with them, they're up walking the very next day, putting all their weight on it. And usually by the third day, we're sending them home. And then we see them back in the office in a week. And usually by about 2 weeks, they're walking back into the office and they're really doing surprisingly well. So it's just to show you an example, I just brought this along, what it would look like. There are many companies that manufacture them, but this is the part that would go into your femur, and this is the part that would fit up into your pelvis. In between the two, new hip joint. So lastly, it's really, we do it so commonly we forget that it's really a kind of a modern day miracle. If you lived even 50 or 60 years ago and you had an arthritic hip, you were just stuck with it, and your life would gradually deteriorate because you couldn't use your hip anymore. Now it's almost like magic. Put a new hip joint in there. After a couple of days you're walking, and within a month or so, you're back to your normal self. So